Today we're looking at a robot surgeon that corrects its own mistakes. So let's get straight to it. So researchers at Johns Hopkins and Stanford University have developed a system called SRT-H that enables a standard surgical robot to autonomously perform a part of a complex gallbladder removal. This isn't just a robot following a pre-programmed path though, it's a system designed to perceive, decide, act and even correct its own errors in real time. So the big idea is to move beyond simple automated tasks towards step-level autonomy in surgery, using the same Vinci robots that thousands of hospitals now already own. It's a compelling goal, but success hinges entirely on the execution, so let's dig a little deeper. So the central idea depends on a clever hierarchical system. A high-level AI looks at the surgical video and decides what to do next, issuing commands in natural language, like clip the cystic duct. And then a low-level AI then takes that command and figures out how to move the robot's arms in order to do that. And so the most critical part of this is the system's ability to self-correct. If the robot misses a target, then the high-level AI can notice and issue a corrective command like move the right arm to the right. And then the low-level AI performs that task. So now let's look at the evidence. Is the central claim built on a solid foundation? So the authors based their conclusions on a 100% success rate across 8 unseen ex vivo gallbladders. In the lab, the system performed flawlessly, kind of autonomously completing all 17 steps of the procedure and successfully navigating its own mistakes. They even did a preliminary comparison showing that the robot's movements were smoother than an expert surgeon's, although they were significantly slower. So while this is a really good start, this is all conducted in a sterile, non-living environment. It's a brilliant proof of concept of the AI architecture and how things can be designed to take on different aspects of what's required during something like a complex surgery. But it doesn't necessarily prove clinical safety or efficacy yet. It is just that, a proof of principle. It proves what's possible, but not what's practical. You know, in real-world settings, you'd run into immediate challenges of the messy, unpredictable reality of live surgery. The system was trained on clean pig tissues outside of the body, and this kind of static, bloodless environment is a world away from the real operation, with a breathing, tissue movement, and where things like sudden bleeding can obscure the camera. So the AI's current vocabulary of simple corrections may not be enough to handle a situation where a bleeding blood vessel suddenly floods the field of view. So I think it would be important for next steps to include maybe building a kind of chaos simulator where before moving to testing on live tissues, you could augment the training data with realistic simulated adverse events. So maybe digitally adding blood spatters to the camera, obscuring the field of view, introducing tissue motion, and using generative AI to create unexpected anatomical variations that would help train the model to recognize and recover from this much richer set of failure states, building a more robust system than this idealized perfect environment. And I think an important goal isn't necessarily just the speed or even 100% task completion at this stage. A critical metric would be safety, demonstrating that the system can handle the dynamics of a living organism, and most importantly, that it can fail gracefully by stopping and alerting the human supervisor when it encounters something that it doesn't understand. Because that will inevitably happen in real practice. A 100% task completion on a simple task is important, but you also need to think about what happens if things do go awry. So using a hierarchical system with a language-based interface like this for corrections is a foundational breakthrough. It moves us away from rigid automation towards more adaptable intelligence. So it's a really interesting proof of concept, but its success will now depend on their ability to take the next step, generating more robust real-world evidence from more dynamic live surgical environments. That's all for today. If you found that useful, don't forget to hit subscribe so you don't miss future episodes.